नर्सिंग टफ है, लेकिन हम नर्सेस उससे भी ज़्यादा। एग्री? हेलो एवरीबॉडी, आई वेलकम ऑल टू रेवोल्यूशन इन नर्सिंग। आज का जो टॉपिक है वो बहुत ही मज़ेदार है और डिमांडिंग भी है। इसमें बच्चे बहुत कंफ्यूज रहते हैं और याद भी नहीं रहता। इसलिए आज मैं आपके लिए लेके आई हूँ ड्रग स्टेम शीट फ्रॉम ए टू अल्फ़ाबेट जेड। इसमें आपके जितने भी कॉन्सेप्ट्स हैं, जितने ड्रग्स हैं, वो आपको तुरंत और आसानी से याद हो जाएंगे। सो लेट्स बिगिन एंड क्लियर योर कॉन्सेप्ट्स लाइक वाटर। उससे पहले प्लीज़ लाइक एंड सब्सक्राइब माई चैनल, क्योंकि ये चैनल आपका सिर्फ वन स्टॉप सोल्यूशन है ऑफ ऑल द क्वेरीज। एंड कमेंट मी इफ़ यू वांट एनी वीडियोज़ ऑफ एनी टॉपिक। सो लेट्स बिगिन। सबसे पहले है अल्फ़ाबेट ए में हम स्टार्ट करते हैं हमारे पहला AC। हमारी स्टेम है AC। क्लासिफिकेशन है नसेड्स। नसेड्स स्टैंड्स फॉर नॉन इन्फ्लेमेटरी स्टेरॉइड्स एंटी इन्फ्लेमेटरी ड्रग्स। उसके अंदर ये एसिटिक एसिड के डेरिवेटिव्स हैं। एग्जाम्पल्स हैं ब्रोमोफेनेक, डेक्समी, पेडोलेक। जैसे कि आप देख सकते हैं लास्ट में AC है, तो अगर कहीं पे भी आपको AC दिख जाए तो वो याद रख लेना ये नसेड्स हैं। AC से वैसे भी हमें अच्छा फील होता है, तो नसेड्स भी क्या करते हैं, हमारी इन्फ्लेमेशन को कम करते हैं और नॉन स्टेरॉइडल होते हैं। नेक्स्ट इज़ एफिल। एफिल comes under the classification of inhibitor of PD5 with vasodilator action. We all know, and it's a very famous example is sildenafil, which is also known as Viagra, which will have vasodilatory action. Another example is tadalafil. Next is third, allol. It's the combined alpha and beta blockers. You know, alpha blocker function and beta blocker functions. If you don't know, then check my another videos, and if you want to know about all the alpha and beta receptors, their blockers and autonomic nervous system, please comment. Next, its example is labetalol and medroxalol. It is different from propanol type drugs, which we'll study ahead. So if in the last it comes ALOL, then please make sure that it is alpha and beta blockers classification. Next is andro. This you all know, androgens, for example androlone. Next is anserine. It's come under the classification serotonin 5H2 receptor antagonist. So you all know that serotonin receptor we also called 5H2 receptor. So it antagonize means it works opposite. So its examples are, we have to just write alt and the prefix anserine, alt anserine or trop anserine. So these are the stems starting from A. Next is sixth one, A's. You all know it's the classification under enzymes. There are many enzymes like carboxylase, enterase. Now seventh is hexene. Drug and class definition and classification under anti-anxiety or antidepressant, which examples are vanilla, flexin. Eighth is azepam. We all know diazepam type, anti-anxiety, lorazepam, diazepam. Lorazepam and diazepam. Ninth is azocin. We all have heard about it. It's anti-hypertensive drug. There are many antihypertensive drugs like ACE inhibitors, ARBs. So it's one of the classification of antihypertensive drugs. And if the prefix you see azocin, then keep in mind that it is antihypertensive drug. Example, doxazocin. The next is azoxyme. See the difference? It's SIN and 10th is CINE. These are narcotics. It may be antagonist or agonist, but the classification is under the narcotics. Example, ketoazoxime. So we have learned stem A is AC, that is NSAIDs, AFil, that is PT5 inhibitor, ALOL, alpha and beta blockers, androgens, anserine, 5-HT, that is 5-HT receptor antagonist. And you can see also that serotonin, that here serotonin, you will also read that here serotonin, SER is same as SER. So you can learn from it that it's serotonin. So the next is ACE enzyme, exin. Here again we get anxiety X and exin. So vanilla flexin. The next is diazepam, which is lorazepam and diazepam. Then antihypertensive is azocin and narcotics is azoxyme. So next we come to B stem. Now let's see about the B stem. Here is Bactam. We all have heard about it. That is beta lactamase inhibitor, Cellbactam. Okay. So next is Barmate, which are tranquilizer that reduces our pain. Then antileptics, which include examples like meprobamate and felbamate. See, we just wrote Barmate like it works like balm. We use balm at home, so they are used for they are used as tranquilizers or in severe cases antileptics. So we can learn it like this: meprobamate and felbamate. And above first one was Bactam, that is beta lactamase inhibitor, Cellbactam. Third one is Barb. We all heard about it, that is barbituric acid derivatives, and it comes in between like phenobarbital, secobarbital. And the most now advanced is instead of barbiturates we use benzodiazepine. These are anti-anxiety drugs. Then next is Bufen. It's NSAIDs phenbufen derivative. Okay, and it is different from which we all get confused. One is Bufen and ibuprofen. These are profen. These are both different. Okay, and both are the same thing as both are NSAIDs, but the derivative are different. This is phenbufen derivative and example is endobufen. So next is butan, which we all know it's antiseptic like lobutan, dapabutan. Bhutan is like, we can remember that it's a country, Bhutan, and it's a country, so we can like that there are antiseptics there, they use a lot of antiseptic, so we can learn like this. The next is butazone zone. Then there is a particular zone there, so which act as anti-inflammatory zone or analgesic zone. So we can learn like this. Example is mofeburazone. So these all are the B stem. Then the next is C stem. In C stem, first is Carbef. Carbef, have you heard about it? This is antibiotic. It's come under the classification carbazepam. Example is carbazepam. Next is Cillin. Penicillin, example ampicillin. You all have heard about it. Next is COG, that is blood coagulation factor. Example eptaclog alpha. Next is conazole, that is antifungal fluconazole. Next is cortisone derivative hydrocortisone. Curium, very important, you need to learn this. Curium, it's neuromuscular blocking agent and it is atracurium. Next, cyclin, it is antibiotic which comes under the tetracycline derivative. Example is tetracycline. So you see, they are very common and you have all heard about it. So it is carbasef, classification of antibiotic, and cycline, classification of antibiotic, then penicillin, again classification of antibiotic, Coke, blood coagulation factor, conazole, antifungal, cot, its cortisone derivative like hydrocortisone, curium, neuromuscular blocking agent, that is atracurium. Next we have D, only two. So here we have darilazine, which comes in antihypertensive, that is high, we say high, so it's high drelazine. Next is dronate, which is calcium channel regulators. It is again antihypertensive, so we can use this etidronate. Both is drelazine and dronate, calcium channel antihypertensive, calcium channel regulators. So these you have to learn, only two, drelazine and dronate. Drelazine is antihypertensive and etidronate is calcium channel regulator. And you have heard about drone. So what does the drone do? It flies and captures photos and the scene around. So we need to operate that, we need calcium. We can learn it like that. So dronate is calcium channel regulators. It is etidronate. Okay. So the next is E stem. In this first is actin. It is antiparasites. An example is doramectin. Second is erg. You have all know this ergot derivative. So we use erg. ERG. So example is pergolide. Next is atenide, which is a diuretics. An example is, we just have to write BUM and the prefix atenide. So bumetanide. So there are only three stems in E alphabet, that is actin. Example is doramectin. Second is erg, that is ergot derivative. Third is atenide, that is diuretics. The next is F stem. So there are four. First is phenamic acid. You have all heard about it. Anti-inflammatory analgesic. Example, mefenic acid. Next is phentalin. This is also very important. Phenamic acid, phenatil. This is an acids classification and it includes L-fentanyl. Third is fibrate, which comes under class antihyperlipidemics. Example is bezafibrate. Then antihyperlipidemics, it has asked in many times in NORCIT. So you need to know that what are antihyperlipidemics. In that one comes as fibrate. So you can learn like that lipids, the fiber in our body. They're present like fibers in our body, just to remember. So fibrate, antihyperlipidemics, benzafibrate. Fentanyl, phenamic acid. The next is fluran. Inhalation agents, isoflurane. You know, inhalation agents, like we have blue color, then we have yellow color, we have purple color, we have 5, red color, black color. These are all used in OTs and these are inhalation agents, are used as inhalation agents. These are the color codings which are given to various inhalation agents. So isoflurane, do you know that it is which color coding? It is of which color coding? Isoflurane is purple. So if you want to know about all the inhalations agent and their color codings, please comment. I'll tell you everything with the trick, and it's so easy that you can't miss 1 marks also. So this is all about F stem. 4, phenamic acid, phentalin, fibrate, and fluorine. Next is G stem. G stem is quite big. So let's start. In G stem, first is gest. It is progestin. Example, megestrol. Next is glen. We have heard about it. It's myoinhibitors type B. That is seleginil. It is different from GILLIN. See the difference between spelling? It is antibiotic, which is aspergillostrine. We have learned about 3 antibiotic classification earlier. That is penicillin, carbazepam, and tetracycline. This is another which we get from aspergillus strain, that is glen, and example is mitoglin. Next is gliptin, very important anti-hyperglycemic. Okay, when your sugar level increases, we give it to reduce it. So gliptin, that is vildagliptin. So we can write as vildagliptin. Next is grel, that is platelet aggregation inhibitor, like clopidogrel. You have also heard about it, and it's very important. So these are very important. Gest also, like we use in progestin. Glen also, that is my seleginil. Then next is glen, mitoglin, gliptin, vildagliptin, grel, clopidogrel. These are all very important, so you need to learn all this. Next is glitazar. In glitazar, that is anti-hyperglycemic. Again, these both are anti-hyperglycemic, like we have learned here. Anti-hyperglycemic gliptin, yeah, we have learned this gliptin. Now we have two more, glitazar and glitazone. Okay, so it is PPRA agonist, and this is PPST agonist. Example is, we just have to write FAR and glitazar. In this, we just have to write a C glitazar. So zone, we will see, we'll go and see zone, so C glitazar. And there is FAR and ZAR, so FAR glitazar. See, there is, you can remember it very easily, that where we have to write FAR and C. So this is all about G stem, gest, progestin, myoinhibitor seleginil. Then we have antibiotics, that is mitoglin. Then we have 3 anti-hyperglycemic and grel, platelet inhibitor. Next is I stem. So in I stem, we'll start with AIIMS. Have you heard about it? AIIMS, immunostimulant and immunosuppressive. You must have heard about immunosuppressive, which is very important tacrolimus. If you have ever gone to skin OPD, they also give. If you ever gone to cancer department, they also use it. It's used in various units. So very important. Immunosuppressive, which suppresses your immune system, and inflammatory reactions decreases. So its prefix is AIIMS and its tacrolimus. When we want to stimulate, so we use X. So Pharmacology. Okay, so immunostimulant is Pharmacology, like Fox. You can use it at Fox is very clever. Why? Because she is always on stimulant. So MX and Forfinix. And AIIMS we know, tacrolimus. Next is Erudin, that is anticoagulant desirudin. You know, anticoagulant which prevents from coagulation. So desirudin. And we have previously learned about platelet aggregation. That is, it prevents from platelet aggregating and preventing the clot. That is grel, and example is clopidogrel. It is anticoagulant. If coagulation prevention we wanted, it is used for that. So desirudin. Next is L stem. We have again only 2, that is leukin and leucast. Very important. You have learned in pathology also many times about interleukins and leukotrienes, in pharmacology also. So it's very important. So leukin It's again leukin. It's written from the word classification is interleukin, and leucast from leukotriene. So leukotriene, when we want to antagonize, we use monteleucast, that is we can use for allergy in decreasing inflammation, and leukin is decileukin. Okay, so two, very easy, leukin, leucast. Next is M stem. So in M stem, first is MAB, monoclonal bodies like capromab, declizumab, very important. Then antiviral, we know antiviral vir, that we will study ahead, but for now antiviral are which have prefixes mentadin. So just write re and mentadin. You know that viral infections occur again and again, so for recurrent we use re, so that's only re, mentadin. Then milast, anti-asthmatic, anti-allergic. Example, piclamilast. Asthmatic, you know that it lasts for a long time, it is chronic, so me last, you can use it like that, it lasts for long. Example is piclamilast. Next is monum, again antibiotic classification, that is gloximonum. Next is antineoplastic, mustin, example carmustine. So mustin, antineoplastic, we must go for checkups regularly to prevent any to prevent any unwanted growth, so that's only anti-neoplastic. Example is carmustine. So these five are M stem, MAB, mentadin, milast, monum, mustin. Next is O stem. O stem, we have OLOL. We have learned earlier that about alpha and beta blocker, in which we learned about A lol, and I told you that don't get confused with OLOL. Its example is, can you tell guys what's its example? It's labetalol, alpha and beta blocker. So this is beta blocker, propranolol type. Examples are timolol, atenolol. Clear? Next is OLONA, that is steroid, no prednisone derivative. Okay, we have steroids that are prednisone derivatives, but this is not prednisone derivative, but it is steroid. But these are steroids like minoxidil, but these are steroids, not prednisolone type. Example, minaxolone. Next is orphan, very important, very commonly used and easy, that is narcotics, antagonist and agonist. Example, dextrorphan and methorphan. Combination is oxacin, another classification of quininols. So these are quinol derivative. Example, ciprofloxacin. Next is antidepressant, oxytocin, that is duloxetine. We need to cancel out the depressant, so oxytocin. So I told you earlier that antidepressant X, we want to cancel out the depression, so oxytocin. I also told you earlier that X, that was for anti-anxiety. Do you remember what was the word? Its prefix was Xn. Okay, so what was the word? It is venlafaxine. Venlafaxine and the prefix. Okay, and there was one more antidepressant classification which we have, that is diazepam, which was given benzodiazepam, and which comes under classification of benzodiazepam, and we learned about azepam, and one was Exin, and this is oxytocin. Okay, So if in anyone's ox come and you did not get which classification it can be, you can still go for antidepressant or anti-anxiety. Means more than 50% chances that your question can be correct. So next is, and yeah guys, for your 100%, if you want that you get 100% correct, you need to learn it, and you can learn it in very, by relating it to something or someone. Some examples I am giving and tricks I am telling you, some you can form by yourself also. It's very easy. When you revise again and again, when you watch this video again and again, you make a use 2x speed to revise it, but you will get it. So next is P stem. So in P stem, first is pamide, which comes under diuretics, sulfamoyl benzoic acid. Example is edipamide. Next is parin, which is heparin. You all know heparin and deltaprim. Next is pidem, which is hypnotic sedative, and example is zolpidem. Next is peridol, which is antipsychotic. Haloperidol. Peridone, see peridone, antipsychotics, it is risperidone. So let's learn. First is pamide, which is a diuretics. Example is edipamide. So you can use like that for diuretics, that is we or loss of fluid, so we use pad, so pamide. The next is parin, that is heparin. Then the next is pidem, zolpidem. So pidem is hypnotic sedatives which induces sleep. So pidem. And peridol and peridone, both are antipsychotics. Peridol, haloperidol, risperidone. Then zolpidem, like zombies come. You when the sleep induces, you think about things which cannot be possible. So zol means zombies, they piled up in your house. So zolpidem. Then heparin, idipamide. Okay. The next is poietin, which comes under classification erythropoietin. Examples are epoetin alpha. Parazole is PPI, omeprazole. You must be aware of it for sure. In your house also, you can get it very easily because somehow anyone must be using it. The next is paramine, which is antidepressant. So like imipramine, it is a classification of antidepressant. Prednisone derivatives. One we have learned earlier, that steroids which are not prednisone, like mixozolone, we have learned it. Now this is pred, in which pred need to come. So prednisone derivatives. Example, prednicarbate or cloprednol. So in one, pred is suffix and then another pred in between, but pred needs to come. So prednicarbate, cloprednol. The last of P stem is pril, that is antihypertensive. These are ACE inhibitors, classification under antihypertensive. So pril is captopril. So we have learned about pamide, parin, pidem, peridol, antipsychotics, peridol and haloperidol and risperidone, hypnotic zolpidem, heparin and dalteprine. Where there are enoxaparin also. And then diuretics, edipamide, erythropoietin, poietin alpha, PPI is omeprazole, antidepressant imipramine, prednisone, prednicarbate, then antihypertensive cleptopril. Then R stem, only there is one, that is neoplastic antibiotic. An example is edarubicin, epirubicin. Very easy. The next is sartan. Then S stem. First is sartan, statin, sulfa. Sartan is ARB. This is antihypertensive. Under antihypertensive drugs, ARB are the classification. ARB is angiotensin receptor blocker, angiotensin 2 receptor blocker. So it decreases, helps to decrease in the BP. So antihypertensive drugs. Example is losartan. Next is statin, which is renal hydroperidase inhibitor and pepsin inhibitor. Yeah, these are two enzymes which it inhibits. Hydropeptidase inhibitor and pepsin inhibitor. Example are cilastin and pepstin. The next is stir, the steroids. So stir, it is the stir, so testosterone and sulfa, another classification of antibiotic, that is sulfasalazine, we can write it. So sulfa antibiotic stirs testosterone, statin inhibitor and sartan is ARBs. Then T stem, this is sterol, that are bronchodilators, albuterol, then thiazide, diuretics, chlorothiazide, and trexate, antimobilide, methotrexate, triptyline, antidepressant, amitriptyline. Okay, so these are T stem: sterol, albuterol, thiazide, diuretics, chlorothiazide, trexate, these are antimetabolites, methotrexate, triptyline, antidepressant, amitriptyline. Then U stem, we have uracil derivatives which are used as thyroid antagonist and antineoplastic, which is fluorouracil. Then V stem, vastatin, we have learned about it, antihyperlipidemics earlier also. Learned it from fibrate. Yeah, this was the prefix. So this is another antihyperlipidemics. This is HMG co-inhibitor, vastatin. So lovastatin, or we can write as sim plus vastatin, simvastatin. So these are antihyperlipidemics, very important. Next is antiviral, where antiviral, there are examples are gens, which is prefix is ganciclovir. In between it is envirodine and suffix is viroxine. These are all antiviral. Then last but not the least is Zumab, that is humanized antibodies. Example is natalizumab or bevacizumab. So thank you for watching and please like, share and subscribe my channel. और आगे भी ऐसे ही इम्पॉर्टेंट कॉन्सेप्ट्स क्लियर करने के लिए और इन्फॉर्मेशन जानने के लिए प्लीज़ सब्सक्राइब माय चैनल एंड कमेंट ऑन द टॉपिक्स जिसके नोट्स आपको चाहिए. थैंक यू. होप यू लाइक इट.